You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning, and today is Friday, March 9th, 2018. A now fired staff member with the Kansas Department for Aging and Disability Services improperly disclosed personal information for 11,000 people in an email sent to multiple addresses, state officials acknowledged late last week. Department spokeswoman Angela DeRocha said that the breach includes social security numbers, birth dates, and other identifying information for Medicaid recipients and others. The agency said it had no indication the information had been misused since the disclosure wasn't discovered until late last month. The information was improperly emailed to local contractors with the state's 11 area agencies on aging. The state is contacting affected individuals to inform them about the data breach and recommending they freeze their credit information with the 3 major reporting bureaus. The employee responsible was fired, and the state is reviewing its security policies. McKnight's Long-Term Care News reporting. In a webinar presented by Direct Supply last Tuesday, it is suggested that long-term care companies aren't investing enough tech and that the landscape for technology in long-term care is changing. Statistics cited in the webinar that indicated that 83% of senior living corporations believe they have underinvested in technology, and that same proportion also indicated they believe that they will either be acquired by a more technologically advanced entity or face bankruptcy. They identified 4 major trends in senior living technology, the first being enhanced security through such mechanisms as electronic access control, video surveillance, and wireless locks. The second being wireless connectivity. The third, conducting community and resident engagement among other processes digitally. And the fourth, the presence of emerging technologies like Internet of Things, IoT, artificial intelligence, AI, and smart building solutions. Some of those technologies have already made headlines in several different industries. In senior living, the IoT is manifesting in such devices as vital sign monitors and pressure sensors that can monitor resident movement, heart rate, and sleep patterns. Though AI is still in the early stages, learning and predictive algorithms could help predict diagnoses as more and more health care data becomes available from electronic medical records and sensors. Skilled Nursing News reporting. Florida's House of Representatives has ratified a rule requiring nursing homes to have backup power sources. The House unanimously approved the measure, which now heads to the state Senate. It would require facilities to have a generator capable of keeping facilities at 81 degrees Fahrenheit or lower for at least 4 days. It also requires them to keep 72 hours of fuel on site. The rule was originally issued by Governor Rick Scott and the Agency for Healthcare Administration after the residents died in a sweltering South Florida nursing home following Hurricane Irma. The state's 577 nursing homes must comply by July 1st, but AHCA can grant an extension until January 1st for delays in installing equipment. The bill doesn't include assisted living facilities over Scott's objection. Associated Press reporting. A group of Democratic senators want the Trump administration to reverse its steady rollback of regulations on nursing homes. In a letter sent to Alex Azar, the Secretary of the Department of Health and Human Services, as well as Seema Verma, Administrator of CMS, the Democrats allege that the regulatory rollback will, quote, inevitably weaken the safety of our nation's nursing homes and put patients, many of whom are elderly and wholly reliant on this care, at greater risk. The letter says that a series of CMS memos released in the last year make it more difficult for federal regulations to fine or deny federal payments to nursing homes that don't meet certain quality and safety standards. The letter, led by Senators Richard Blumenthal of Connecticut and Amy Klobuchar of Minnesota, was dated February 14th. In July, CMS released a memorandum intending to lessen fines against nursing homes that have not complied with the health and safety standards. In November, CMS imposed an 18th moratorium on the imposition of fines and denials of federal payments when nursing homes fail to meet certain requirements, such as ensuring there is an adequate staff on site, providing behavioral health services, or using psychotropic medications correctly. The Hill reporting. Authorities say a sprinkler system helped avert disaster last week when fire broke out in a Wheeling, Illinois nursing home. Wheeling fire crews were called to the Adelaide Villa Senior Living Community at about 6:30 p.m. last Thursday in response to the fire. The first firefighters to arrive found 2 fire sprinkler heads extinguishing a bedroom fire on the 3rd floor of the 4-story facility. The resident of the unit was rescued by firefighters and admitted to a hospital for non-life-threatening injuries, officials said. Firefighters and police evacuated several residents safely. The building where the fire started houses more than 100 residents and is one of the 4 interconnected buildings at the facility. If not for the sprinkler system, it is likely the fire would have caused fatalities, Fire Chief Keith McIsaac said in a news release. The cause of the fire is being investigated, but officials do not believe it was suspicious, the Daily Herald reporting. Now for In the Headlines. From Provider Magazine, MedPAC considers steps to drive Medicare beneficiaries to quality post-acute care. In a report before a public meeting of the Medicare Payment Advisory Commission, MedPAC, staff told commissioners that in encouraging Medicare beneficiaries to seek out higher quality post-acute care, hospital discharge planners should be equipped with the tools and authority to recommend providers, something they currently lack. Medicaid Managed Care Plans chief sees more shifts ahead. Jeff Myers, President and Chief Executive Officer of the Medicaid Health Plans of America, tells Provider he sees even more populations served by long-term and post-acute care providers coming under managed care, like the intellectual and developmental disability segment, citing PricewaterhouseCoopers report that showed 74% of Medicaid beneficiaries are in a full-risk managed care product. And from McKnight's long-term care news, congressional opioid efforts targeting Medicare limits on new prescription. A bipartisan group of senators introduced legislation last Tuesday that would set a 3-day initial prescribing limit on opioids for acute pain and increase recovery services and availability for addicts. The legislation would change policies and make more funding available through the $6 billion earmarked for opioids and mental health treatment in a 2-year budget deal struck last month. This has been your long-term care news update. Everyone have a wonderful day, and I'll see you next week.